white coats, and it deals with the phenomenon of the increased numbers of minors who are identifying as transgender and seeking sex-rejecting procedures, castrating chemicals and mutilating surgeries to treat their condition. The report has several sections to it. It does address the dramatic rise in the number of minors identifying as transgender, which is just a new phenomenon over the past 10, 15 years. It's not simple epidemiology. This is a social contagion that the kids are being drawn into. Part of the report does discuss the financial incentives that some of these gender dysphoria clinics and centers had to bring these kids in. And as opposed to treating them with mental health counseling, competent counseling, which science says is the best way to treat these children, they push them toward these sex-rejecting procedures. And as it turns out, that can be very lucrative. So we believe for some of these places there was a financial incentive. And the report also deals with potential fraudulent coding to get money from insurance providers to cover these sex-rejecting procedures. And then part of the report deals with really the push by the Biden administration to normalize sex-rejecting procedures and really push kids into this. And the final part of the report talks about the stories of some of the detransitioners themselves, heartbreaking stories of these kids and their parents and their families who weren't given good informed consent. They weren't told, listen, we can treat you with mental health counseling, and that's what you really need. They were pushed toward these castrating chemicals and mutilating surgeries.
Now, in the announcement today, you spoke about the term, and you just mentioned it, gender-affirming care. Talk to us about how this is misleading. You said it was misleading, and elaborate on sort of some of the risks that come with these procedures.
Yeah, exactly. I think the term gender-affirming care is such a lie. Number one, you can't change your gender. Boys are boys, girls are girls, and that doesn't change. Number two, there's nothing affirming about the chemicals they use, the cross-sex hormones or the puberty blockers or these surgeries, highly invasive mutilating surgeries. There's nothing affirming about that. So I think the term gender-affirming care is a lie. It's a misnomer. Instead, again, what these kids need is mental health support and counseling. But with the sex-rejecting procedures, that's how we refer to them, not gender-affirming care. Sex-rejecting procedures is certainly more descriptive and more accurate. There can be complications. Can be lifelong fertility ramifications. There can be bone health complications. And the surgeries can have complications that can cause problems for the rest of these kids' lives into adulthood. No, there really are tremendous potential downsides with sex-rejecting procedures. And so often, these children and their parents were never informed of that.
Now, Vice President J.D. Vance commented saying, quote, convincing vulnerable children to reject their gender can create patients for life. That's an interesting concept. Could you, talk to us about how doctors and hospitals are profiting from this and what they mean by this?
Well, I think what he meant, we talk about in the report about captive patients. In other words, if you get a child and you get them on, let's say, cross-sex hormones, you take a little girl and put her on testosterone, or a little boy and put him on estrogen. Well, they're going to be on that forever and ever, right? And they're going to have to come back for laboratory studies and get their prescriptions filled and checkups. And if you do the surgeries, which can be very lucrative, you've got captive patients. They keep coming back, and they can keep making money off those individuals. I think that's what the Vice President was referring to, and I think he's exactly right about that.
Admiral, you are also a surgeon yourself, so I'm sure you look at this in a sort of a deeper way than many others. Of course, there's the black and white male-female aspect, but when it comes to a physician's responsibility to the patient, these are young people, many of whom, as you point out, regret these life-altering surgeries. So from that perspective, how do you view the physician's role in all of this?
Yeah, all I ever wanted to do was be a doctor, be a surgeon. That's as long as I can remember. I'm a urologic surgeon by training for over 3 decades. When you take care of a patient, number one, you're going to do surgery. You have to have good informed consent. Be honest with the patient. Tell them what the pluses and minuses of the treatment could be. Tell them what the complications could be. These children weren't informed of that a lot of times. Plus, when you graduate medical school, you take the Hippocratic Oath. You do take an oath where you say, I'm not going to harm my patients. I'm going to help them. I'm going to care for them. I say, I'm going to love them. So you go back on your Hippocratic Oath when you're doing things to patients that can cause them irreversible harm, and you know that can cause them harm, and you don't tell them about it.
It's really incredible. You also said what these kids really need is compassion. What do you mean by that? And by changing the norm for dealing with these cases, how are you and your team ensuring that these minors get the care that will actually help them?
Great question. We know that if you take a child with gender dysphoria, and gender dysphoria is a real condition, it's a mental health condition, right? If you take these children and you give them counseling, compassionate, competent counseling and mental health support, and I would say personally, as a Catholic, that if their parents wish, pastoral care as well, if the parents think that's important, but certainly the mental health component. If you care for them with mental health care and counseling, the vast majority get through their gender dysphoria by the late teens. They don't need castrating chemicals and surgeries. They need that compassionate counseling. We're advocating for that. Listen, we are evangelizing about this. Secretary Kennedy, myself, Dr. Oz, Vice President Vance, we're evangelizing about this to tell parents and to tell kids you don't have to have these mutilating procedures and castrating chemicals. If you're having issues, then you need counseling and support. That's what's best.
The administration taking on a lot of issues, moving at a rapid clip, I might add. President Trump recently signed an order aligning U.S. vaccine recommendations with those of other developed nations. How is this ultimately meant to improve the vaccine schedule and help parents make more informed decisions?
Yeah, another tremendous win for the American people coming from President Trump. We looked at HHS, on the President's order earlier in the year, we looked at other peer countries and their childhood vaccine schedules. And what we found is that in this country, we recommend many more vaccines than other countries do, peer countries. There's a group of about 11 vaccines that countries seem to agree upon, childhood vaccines, things for like measles, mumps, and rubella separated out, things like polio, diphtheria, tetanus. Those are the vaccinations that countries tend to agree upon, and we think those are important to recommend to our children. The other vaccines that kids seem to be pushed toward in this country, that's something that we believe, and more importantly, the President believes, should be a shared decision between the parents and the trusted practitioner. Don't automatically shove these kids toward getting the vaccines. Let the parents have a say in what's going on with their children. And when possible, space out these vaccines. Separate the measles, mumps, and rubella into separate vaccinations on separate days. Do that whenever possible. We think those things are really important. So again, we're always led by gold standard science. Secretary Kennedy has emphasized that from day one. We are always led by science. We are always led by the desire to protect our children and protect our people. And we always want to do, as the President says, let the parents be involved in these decisions.
And vaccine mandates, obviously a major flashpoint during COVID-19 throughout our country, our military, our federal government. How did the U.S. approach this compared to, say, some other countries? And where do you think we got it wrong?
I think one of the reasons that people lost confidence and trust in healthcare policy coming out of Washington during the last administration is because there wasn't transparency. There wasn't the ability to say, you know what, we did get this wrong. In this administration, if we make mistakes, we're going to admit to that. Other countries handled the vaccines in a different way. They really recommended those or had recommended those to individuals who are at higher risk, perhaps more elderly or obese or other compromising medical conditions. Here, again, we had the heavy hand of government pushing these vaccine mandates. People need to be able to make decisions about their health, what's right for them. They need to be able to choose what's right for them and their children. That's incredibly important. You know, in the hospital I worked at, where I did my surgeries, like so many, I was forced to take the vaccine to keep doing the surgeries. We need to let people be able to make decisions what's right for them and right for their children.
To your point about trust, obviously we saw Senator Rand Paul holding a major hearing with Dr. Fauci, releasing some of his so-called diary writings. And what we found were, you know, his private assessments in his personal writings did not line up with his public statements and sentiments. So what is being done to rebuild trust, and how damaging can something like this be?
Oh, I think tremendously damaging. So in terms of Dr. Fauci, you know, just recently some texts were released, and there were some of his texts where he had concerns he expressed about pregnant women getting the two, you know, COVID injections or vaccinations, and then potentially linking that to, it was potentially linked to a possible miscarriage. Whereas then in public, a month or so later, he said, oh, there's no red flags. Just because there's a potential leakage doesn't mean it's scientifically factual, but clearly he was thinking something different than he was saying, and that erodes trust. I come from Alabama, and I remember very distinctly when I was first practicing as a urologist in Birmingham, I had an elderly African-American patient come to see me, and he had a rising PSA. That's a screening test for prostate cancer. And I said, your PSA number is high. I'm not saying you have prostate cancer, but you might, and we should do a biopsy. And here's what he said. He said, I remember Tuskegee. I remember what the government did to my people. The famous Tuskegee study on black men, not telling them they could treat their syphilis, letting their syphilis run its course. That eroded trust in healthcare amongst African American men and women in this country for decades. When you have a government, when you've got healthcare policy that is not square with the people, is not honest and transparent with the people, you erode trust. One of the things that we are doing at the Department of Health and Human Services under Secretary Kennedy, we are working hard to restore that trust by being honest, by coming on shows like this, by being open for discussions, open for interviews. We are determined to rebuild that trust. I truly think that we're doing that with the President and the Secretary. We're doing that.
Assistant Health Secretary Admiral Brian Christine, thank you so much.
Thank you so much. Have a blessed day. God bless you, and God bless President Trump and our republic.